Our next topic for discussion is arthritis. And the first thing I want to ask you is, how many kinds of arthritis are there? Now, some of you are thinking there are 2 kinds of arthritis. Maybe some of you are coming up with 3 or 4. There are actually more than 100, but we're only going to talk about 5 today. And the first 2 types of arthritis I want us to talk about are rheumatoid and osteoarthritis. And these are the ones that most people think about when we talk about arthritis. Now, rheumatoid arthritis is a systemic disease. By systemic, we mean that it's throughout the system. So with rheumatoid arthritis, you're probably going to see elevated sedimentation rates, the SED rates that indicate inflammation somewhere in the body. And it goes throughout the body. It can also involve muscles as well. We said the blood work, you're going to see elevated SED rates, C-reactive protein, and rheumatoid arthritis. It usually starts relatively early in life, usually before the age of 40. There are at least 5 different kinds of juvenile rheumatoid arthritis. Children from infancy, age of 1 or 2 on up, can have rheumatoid arthritis. Now, we classify this as either an autoimmune disorder, and most people will call it autoimmune, which means that for some reason your body is attacking itself. Some people are actually culturing mycoplasma from synovial fluid. It's very difficult to do, and standard labs aren't going to do it. But there are physicians who are treating early rheumatoid arthritis with antibiotics in the tetracycline family and actually curing patients of it. Now, the end result of rheumatoid arthritis, if left untreated, is going to be bony ankylosis. Now, I want us to take a little look at that. If you look at that, and look at this picture up here, you can see first we have enlargement of the joint, but notice what's happening to this joint in here. By the time we get down here, that joint has disappeared. This is bony ankylosis. This is the growing together of those bones. And by the time you have bony ankylosis, then you've lost all your joint movement and joint function. Osteoarthritis, on the other hand, doesn't have that. It's sometimes called hypertrophic arthritis, meaning the joint enlarges a great deal. It gets stiff. It's hard to move, but it still is movable. So it's not, we don't have bony ankylosis with osteoarthritis. Osteoarthritis tends to attack or affect weight-bearing joints. So it's more common in knees, hips, spine, and also the fingers. So it's common in knees, hips, spine, and fingers. Hands. We see osteoarthritis. It usually occurs as you go along in years, so 40, 50, 60, and above, we begin to see osteoarthritis. You see enlargement of the joint, but you can still move it even if it is stiff. Now, to treat arthritis, we usually start with drugs in the salicylate family, the aspirin family of drugs. There are a number of different salicylates, and NSAIDs. Now, salicylates and NSAIDs can both cause GI bleeds. So these are the major side effects of that, are the GI bleeds. Now, with salicylates or aspirin, don't forget the ringing in the ears suggests that the patient has reached toxicity levels. Steroids are sometimes used for arthritis. Systemic steroids can be used for rheumatoid arthritis. Now, they're given intermittently. Continuously is going to cause Cushing's syndrome, so that it's dangerous to give steroids for long term. Sometimes we use steroid injections into a particular joint. There's a limitation as to how many can be given, but sometimes that is really helpful for patients. Steroids can also cause GI disturbances, ulcers, and Cushing's syndrome. For a better description of Cushing's syndrome, look at the endocrine tape. Now, we noticed years ago that when patients were going to malaria countries and were taking prophylactic malaria drugs, that their arthritis symptoms got better. So we said, aha, maybe we can use that to treat arthritis. So we sometimes do. We tend to use quinine drugs sometimes. They can also cause nausea, vomiting, and diarrhea, and they can cause blood dyscrasias. Gold is used. Yes, gold, like the gold in your jewelry. Now, you don't just start chomping on your jewelry and try and treat yourself with it. It's medicinal grade gold, but it's the same element. So what's the chemical symbol for gold? AU. And the word is aura, like AURA. Now, gold preparations have usually AURA, Aranafin, Redora, but you can pick up a gold, you can tell if a drug is gold because it has the AU, usually AURA in the name. Gold, when given by mouth, is relatively safe. When given by injection, renal complications are fairly common. Now, it can cause GI distress, but the renal is the biggie thing for us to be concerned about. One other thing about gold is that it takes weeks or months for it to be effective. Unlike aspirin, you take aspirin a half hour later, you've got some relief. This isn't true with gold. Gold is going to take weeks or months to be effective. We also see patients being treated with drugs that cause immunosuppression. So if we call rheumatoid arthritis an autoimmune disease, rheumatoid arthritis is frequently treated with methotrexate. And methotrexate is being given for its immunosuppressant effects. Now, if you remember, we talked about that as a cancer drug. And the side effect then was immunosuppression. So now we're giving that same drug to rheumatoid arthritis patients for the effect of immunosuppression. All right, arthritis number 3 for us is gout. And you may hear it referred to as gout or gouty arthritis. And what happens with gout is that you get uric acid accumulations. So it's a problem with uric acid metabolism. If you can think about a joint, what would it feel like if you had uric acid crystals accumulating in the joint? It would be very painful. That's what's going on with gout. And which joint is most often affected? The big toes. So we often see uric acid crystals accumulating in the joints in the big toe. The pain is excruciating. Patients may in fact need bed cradles, things to keep the sheets from touching the feet. It can be that painful. Drugs that are commonly used to treat gout: allopurinol or Xyloprim. Now, if a physician picks up in the patient and they say, oh, you've got a high uric acid level, you're at high risk for gout, they might put them on allopurinol to prevent gout attacks. So it's often used for long-term management or prevention of gout attacks. A couple things to remember with that, and the most important is to push fluids. So you notice I put 3 glasses of water beside this picture of allopurinol to remind you to have the patient drink plenty of fluid so they can flush that uric acid right out of the body. It's best to give with meals, but the key element they're going to ask about is the fluids. Now, another drug used to treat gout is colchicine, and this is more apt to be used to treat an acute attack of gout. So the order might say a tablet every hour until relief or side effects. And when the patient begins to vomit or get diarrhea, then they've reached side effects, they've reached toxicity, and the dosage will be cut back a little bit. Another drug that is uric, that helps to get the uric acid out of the system, is Benamid. And you might see that being used for patients with gout as well. Patients who have gout may be placed on a low purine diet. So both people with gout and also uric acid kidney stones are going to be on a low purine diet, because the uric acid crystals are part of the purine metabolism. Now, foods that are high in purines, meats, especially organ meats. So patients should not be eating liver, for instance, when they have gout. Fowl. Now, fowl are birds, chicken, turkey, duck. Fish, shellfish. And notice also we have vegetable sources of protein as well. Lentils, dried peas and beans, nuts, oats. If you look at that list, it's primarily protein sources, isn't it? Now, you can't have a patient completely without protein. I mean, that's impossible. But we do want them to reduce the amount of these high purine foods that they're eating. Most patients have difficulty completely controlling gout with diet alone, and they may need to add the drugs that we just talked about. Let's talk about arthritis number 4, lupus. So systemic lupus erythematosus is classed as a collagen disease or an arthritis disease. Collagen means connective tissue. This is an autoimmune disease, which means we're not sure what causes it. If they asked you a question that said, what group of people is at highest risk for lupus? Currently in the United States, the group with the highest incidence of lupus is young African American women. Now, I'm not really sure why, so don't ask me why. I'm not really sure why. But that would be the answer to the question, young African American women. Now, everybody has some risk for it. I mean, both genders, all races of people can get it, but that's where we have the highest incidence at this point. Now, if you look at the manifestations, some patients with lupus will get a butterfly rash, and that means you've got a rash that's on the cheeks. So you have a rash on both cheeks, so that's a red area. That's kind of like the wings of a butterfly, and then a little bit across the nose sometimes. So the butterfly rash. Raynaud's is when you go out in the cold and your hand vessels, the vessels in your hands constrict, and you have the real vasoconstriction. So Raynaud's is common. Sensitivity to light. So you'll find patients with lupus wearing long sleeves and sunglasses whenever they're outside because they're extremely sensitive to sunshine. They lose hair more quickly than most people. And they have the whole arthritis piece with the joint pains. Now, as it continues over the years, it can also damage the kidneys and the heart. This is not something that happens immediately. This is 20, 30 years down the road usually. The management of lupus is exactly the same as the management of rheumatoid arthritis. We're using the same set of drugs to treat lupus that we just talked about for rheumatoid arthritis. And like rheumatoid arthritis, there is no cure for lupus. But this isn't something that kills people right away. Patients with lupus this is a chronic disease, so they live a long time with it, and we just simply work on managing the pain and the issues associated with it. But that's classed as an arthritis, so that's arthritis number 4. Let's look at a question. An adult who has lupus erythematosus asked the nurse what could have been done to prevent the disease. What should be included in the nurse's response? Lupus can best be prevented by eating well and maintaining a normal weight. Lupus is an infectious disease, but it is hard to know who has it until it onsets. 3, lupus is usually transmitted by a tick bite. Or 4, lupus is an autoimmune disease for which there is no known prevention. And the answer, of course, is number 4. It is an autoimmune disease for which there is no known prevention. Now, what disease is transmitted by a tick bite? Lyme disease. When we talk about Lyme disease, this is arthritis number 5 that we're going to talk about. And this is transmitted by a tick bite. If you look at the picture, Lyme disease is characterized by this bullseye type rash around the tick bite. So, and sometimes it's even wider appearing than I have here. So we have this real bullseye rash, just like looking at the bullseye of a target. So it's a big red rash, and it may be around the tick bite. It could also be elsewhere, because sometimes patients will have a number of bullseyes on their body. And these are a bullseye rash. This is the deer tick that transmits Lyme disease. Now, Lyme disease can cause a severe arthritis-like illness, a neuromuscular illness. If it's treated quickly and adequately, the disease will not progress and they will not get the arthritis-like illness. Now, the deer tick is a tick that likes to take a ride on deer. Now, you know what a deer looks like. This picture shows us a deer. Now, the deer is not the reservoir for the organism. The reservoir is actually a mouse, a wood mouse, a little mouse that lives in the woods. So the reservoir is a wood mouse. And somewhere in that tick's life cycle, it has bit a wood mouse. Then it hitches a ride on the deer. So the deer is really the transportation vehicle for it. And that deer walks through the grasses or the bushes on the edges of the forest. And if you happen to walk through those grasses or those bushes, the ticks may get on you. And if the tick is carrying the organism for Lyme disease and it bites you, and remember the tick is a bloodsucker kind of thing, so it will stay on you. It attaches to your skin. Then you can get Lyme disease. So the characteristic finding is that bullseye rash. It's quite common in the United States today. It's in most of the country with the possible exception of Hawaii. But most of the rest of our country, most of the states have had incidents of Lyme disease, and it's quite common. It is treated with tetracycline. We are now currently using about 30 days worth of tetracycline treatment. One of the questions I know they've asked on NCLEX about Lyme disease is, you were talking with a group of parents about preventing Lyme disease in their children. What would you tell them? You would tell them that when their children are playing outside, they should wear long sleeves, preferably ones with cuffs on them, long pants, and tuck them into the socks. These sleeves, this clothing should be light colored. If you are wearing dark colored clothing, it would be very difficult to see a little tick on the dark colored clothing. Now, the ticks can also climb on your clothing and climb underneath and attach to even covered areas like your abdomen or your back. So after you've been outside in woodsy or grassy areas, you really should do a tick check and make sure there's not any ticks on your children. Now, it's difficult to get everybody to adhere to that rule because who wants to wear long pants on a hot summer's day? But that's the answer to the question. Long sleeves, long pants, light colored. And that means that you can see the tick easier. Now, if the patient or if the person has a tick that's embedded, to remove that tick, it would be better. You're not going to use your fingers. If you should squish the tick with your fingers and you had a break in your skin, then that organism could get into your skin that way. So you want to use tweezers. Some people will like to use alcohol or Vaseline and smother it first so that you kill it and it relaxes its grip and it's easier to pull out. Do not burn a tick while it's inside, while it's attached to someone. You burn more than the tick that way. You can get a burn on the person. So that's kind of an old wives' remedy, but we're not going to do that as professional nurses. Now, another related disease that's spread by a tick is Rocky Mountain spotted fever. This is not an arthritis disease, but I do want to address the issue. This is spread by a different tick. It's called the dog tick, which is a bigger tick. It's easier to see, the dog tick. They call it the dog tick because it likes to get on your dogs and cats if they go outside. And you have only 2 guesses to give me the 2 major symptoms of Rocky Mountain spotted fever. You're right, spots, a rash, and fever. The fever is high. The rash is sometimes also on the palms of the hand and the soles of the feet, which is a rare place for rashes. So you get the rash, the fever, terribly violent headaches. If it is diagnosed and treated, patients usually survive, and the treatment includes drugs from the tetracycline family. Untreated Rocky Mountain spotted fever can be fatal. But this is not an arthritis, but it is a tick-borne disease, so I thought we would address it at this time.